Everyone. This is a really teachable question because this question has a lot of answer choices, and I feel like I can definitely go through like a lot of different diseases altogether in just one question. So let's start. Which of the following is the most likely cause of this patient's symptoms? So that's the concept. 45-year-old male presents with hypertension, comes to the physician because of a 3-month history of fatigue, constipation, and shortness of breath. Current medications include a multivitamin. Patient states that he has been working in aircraft maintenance for more than 20 years. Serum calcium concentration is 12.2. Normal is 8.5 to 10.2, so this is somewhat high. An X-ray of the chest shows bilateral hilar lymphadenopathy. Which of the following is the most likely cause of this patient's symptoms? Okay, so this patient has berylliosis. And the reason that this patient has berylliosis is because he has been working in aircraft maintenance for more than 20 years. And the reason this calcium is elevated is because berylliosis presents in a very similar way to sarcoidosis. Both of them have non-caseating granulomas. Caseating granulomas is with diseases like TB, where macrophages and T helper cells. So T helper cells produce interferon gamma, which basically allow for macrophages to come to those granuloma sites, um, and and then be able to release 1 alpha hydroxylase. The 1 alpha hydroxylase allow for vitamin D, for calcitriol production. So that's activated vitamin D, and then the activated vitamin D um, is sent to the kidney and intestines to reabsorb calcium. This is why the calcium is elevated here. And this is also why this patient has constipation because high calcium means less likely to depolarize, uh, which means that peristalsis would be slow, which is why this patient has constipation. Another reason that this is sarcoidosis or berylliosis is because of the bilateral hilar lymphadenopathy. This is very pathognomonic for both of these diseases. But berylliosis is the more likely cause of this patient's symptoms here, since this patient has been working in aircraft maintenance for more than 20 years. So berylliosis is definitely the best answer choice. But let's go over every single answer choice. So let's go from top to bottom. A, histoplasmosis. Histoplasmosis, uh, that's the fungus found in American Midwest, uh, related to bat droppings. Histoplasmosis itself lives within macrophages, and histoplasma capsulatum. You would think that there's a capsule. It does not have a capsule. So just be cautious about that. Even though its name has capsule in it, it doesn't really have a capsule. Next is blastomycosis. Blastomycosis is found in the Northeast. Pigeon droppings, black nodular rash, big cavity lesion in lungs, and broad-based hyphae. B for blastomycosis, B for broad-based hyphae. Next is paracoccidiomycosis. That's found in South America, so Colombia, Mexico. Usually, patient presents with a circular veal. That's like a rash that you can easily Google. It's of course it's a circular rash. It's very very pathognomonic for paracoccidiomycosis. Usually, most questions related to paracoccidiomycosis, they will mention the patient has visited South America. Next is aspergillus. Aspergillus moldy hay or moldy basement. Uh, Sudden severe asthma is associated with aspergillus. It loves old TB, and it grows in 45 degrees angles. Usually, patient also presents with hemoptysis because of bleeding in lung. Next is sporothrix. So that's rose thorn. So patient has, been in contact with roses or gardens. Um, you can use potassium iodide for 1 to 2 nodules, but if it becomes but if it becomes systematic, then you should obviously use amphotericin. Amphotericin is like the go-to medication if a fungal infection becomes systematic. So so next up is going to be the interstitial pneumonia is associated with pneumoconiosis instead of fungus. So asbestosis, that's the most severe one. Bronchogenic adenocarcinoma is the number one complication of asbestosis. It's then followed by mesothelioma. So number one is bronchogenic adenocarcinoma, then mesothelioma. It's also associated with ferruginous bodies. They're like dumbbell-shaped iron-containing bodies, usually found in shipyard workers, insulation technicians, brake mechanics, roofers, plumbers. Um, okay, next is silicosis. That's just associated with patients who work as sandblasters or some are working with a lot of sand. Bicynosis, so that's cotton fibers. Patient is working with cotton fibers. Haven't seen a single question related to bicynosis yet. Have seen as a wrong answer choice, but not a correct answer choice. Uh, the answer is berylliosis for this patient. So berylliosis, um, patient has been working in the radio, TV, aerospace industry, or has been a welder. That's also really common now. So this patient, in this case, the patient was working in aerospace, and has been working there for 20 plus years. Um, patient occasionally you'll find a question where patient has been working in a nuclear facility, and the answer is still berylliosis because the patient has been exposed to beryllium. And coming back to my first point in the video that the berylliosis is often associated with sarcoidosis-like symptoms, but it's not sarcoidosis. Uh, uh, to differentiate between the two, they would definitely give you like more information because sarcoidosis and berylliosis presents with the same symptoms. So they would most likely give you like, hey, patient works in aircraft, or patient works as a welder, or is working in radio or TV. Versus sarcoidosis is going to be more is most likely going to be like just immune mediated with no other information. Option K is anthracosis. So anthracosis is exposure to coal. It's like one of the least severe pneumoconiosis out of the list. Um, Last is nocardia infection. Nocardia is the only gram-positive that is partially steadfast. This patient haven't been exposed to nocardia. They would definitely give you a lot more information. The best treatment for nocardia is TMP SMX, trimethoprim, sulfamethoxazole, and that's it.